Good morning everyone. My topic is GIS in demography and health. These are the contents: demography and population geography, demography and public health, GIS in demography and public health, case studies and references. So, what is meant by demography and closely related term population geography? So, demography comes from the Greek word demos, which means people or population, and grapho, which means description. So, it refers to the statistical study of all populations. And it can be applied to any kind of dynamic population, that is the movement of population with time. That is one that changes over time or space. And also it comprises the study of the size, structure and distribution of populations and spatial or temporal changes in them in response to birth, migration, aging and death. Coming on to population geography relates spatial variations in the distribution, composition, migration and growth of populations with respect to the terrain. So that will mean how much food or the shelter availability or the resources associated in a space that affects the population living in that area. It focuses on the characteristics of population distributions that change in a spatial context. Involves factors such as where population is found and how the size and composition of this population is regulated by the demographic process of fertility, mortality and migration. For example, in really hot areas like deserts or really cold areas like in Arctic, populations seem to be lower. So the general population in that area will be very less compared to the plain areas or in areas where the climatic conditions as well as the ecosystem is suitable for populations to thrive, hence increasing fertility, decreasing mortality and decreasing migration. So next we come to demography and health. As mentioned, demography is concerned with understanding the population dynamics, how populations change in response to the interplay between fertility, mortality and migration. And this understanding is a prerequisite for making the forecasts about future population size and structure, which should underpin healthcare planning. And in this figure we can see the general population in an area, that is population in the world across different countries. So as we can see, India, then China, they are being colored in really dark blue color. That means population here is very high. So here also this is the corona spread across the world, and here also as we can see that this areas with high population seem to have logically high transmittance of corona. So having an idea about the population in an area can help us predict how the spread of an epidemic or in general a disease can be. So demography plays an important role in telling us and preparing us for the diseases or the public health concern with an area. So next is case study 1 it is using GIS to predict human movement patterns in complex humanitarian emergencies, a test case of the Syrian conflict. So as already known, the war areas, or as we have seen in recent times in Afghanistan, Kabul, people have been migrating from their native place to other countries like America, France and usually European countries. So this was a case study done by Colin Campbell in 2019 based on the Syrian conflict. And in this conflict also people have been seen to migrate from their land, that is Syria, to other countries, especially France. And France has been not prepared to house these refugees in a proper way. So they had to make homes in roadsides or in tents and all, and also the government could not provide them with the necessary food or shelter or health needs. So it is a problem that is facing all over the world. So these people have left with what they can from Syria and made their way to France. However, France was unprepared for the influx of refugees and asylum seekers, despite being a first world country with many resources. The recent response to refugees by many countries legitimizes these questions. Many times refugees are not welcome in both their home countries or new countries where they seek refuge. Simply put, refugees are challenging because their needs like food, shelter, sanitation and medical attention, in addition, they are perceived to have no positive impact on the host countries. So refugees are a burden to most of the countries worldwide. So it is important that countries like, especially first world countries, take necessary preparations to house such people who have been through a lot of suffering. In this study, 3 events were chosen based on location, level of violence and precipitation levels. So event 1, it took place in the city of Aleppo, Syria, and on July 28, 2016. And the scenario was non-violent and there was no death for this event, but there were tensions and changes in rebel and terrorist organization structure. And the temperature recorded on that day was 60 degree Fahrenheit or 20 degrees Celsius, and there was also no precipitation rain recorded. So in these figures in 8 and 9, the darker the color, more likely people move in that direction. So this red dot represents Aleppo, and from this Aleppo, and these triangles represent the camp locations, that is the refugee camps in that location. So people more likely were to move to these darker sides, that is this is the buffer zone, and people were predicted to move across these sides, that is northwest or north, and less likely towards the southeast. So in the first figure, second figure, third and fourth represents the possible refugee movement in day 4, day 5, day 6 and day 7 after the unrest has taken place in that area. So the next event happened in Harasta on June 18, 2017. The temperature was about 36.1 degrees Celsius and there was no precipitation recorded. But this situation had case of violence and rebels fired on aid workers, but no deaths were reported. So the orange color line reflects the violence but lack of deaths reported. So this was even a serious case because there were violence involved and terrorists had shot. So in these figures as well, the darker the color are the areas that people are more likely to go. The buffering is smaller in this set of maps than the other two events. The reason for this is that the temperature was higher than the determined more manageable temperature. So in day 6 compared to day 4, the temperature was so high, so people were less likely to migrate to longer distances. However, the darker areas indicate that travel is more likely toward the camps, which cannot be seen until from days 4 to 7. So darker areas represent, so these areas towards the southwest is where the camps are located. So that is more likely to where the people were inclined to migrate. So this is the third event. They took place in the city of Flesia on January 2015. This was both violent and deadly as rebels were engaged with terrorists. The maximum temperature was about 14 degrees Celsius. In these figures, also darker the color, the more likely the people are go to that area. And as we can see, people were more likely to migrate towards the camp areas, and there were less camp areas in this place. But still, people were more likely to migrate towards those regions. Also, the rate at which the people migrate were more. That is why the colors are even darker. This is because death was involved, which increases the rate at which people would do. So there was more panic because death was involved. So people were willing to risk everything they had to migrate to a new place. So conclusion, the primary application of this study is for small forward teams operating at CHE sites and nearby areas. So the output of the project is intended to provide timely information to aid in the decision making that these teams participate in, assist displaced persons. So even if it is a foreign country or a refugee camp that is involved, knowing about how people can migrate in accordance with the situation in the political or rebellious situation in a place, we can have an idea in advance on how to house these people or where to set up new refugee camps or aids for them. So when groups of people are displaced by CHE of any sort, there can be preparations made that will lessen the suffering of those who are displaced. This study and others like it can help government and NGOs know where refugees will be fleeing. Also can help them prepare with resources and personnel they are ready to help, and bring on personnels in the area to help them. So this is the second case study. GIS based modeling reveals the fate of antlion habitats in Deliblatos and Serbia. So the Deliblatos and Special Nature Reserve in Serbia, which is a regional biodiversity hotspot, have drastically decreased over the last 25 years due to development activities. So what in this study, the researchers focused on the abundant antlion species, that is Myrmecalarius trigamus, and wanted to know how in future how their numbers will be affected due to this change in their habitat. So they employed this net sweeping method to count these individuals on the sites on an average, and conducted the study. So what they found was climate change, in addition to the development activities, had a profound effect on the population of these antlions. That is RCP in 2017, RCP rate with an RCP rate of 4.5. So RCP refers to representative concentration pathway, that is greenhouse gas concentration at an average of here 4.5 watts per square meter across the planet. So if greenhouse gas concentration is about 5.5 watts per square meter across the planet, by 2075 there could be a drastic decrease in the number of antlions in this region. And if the RCP was taken as 8.5, suppose by 2050 the RCP worldwide is 8.5, that is 8.5 watts per square meter across the planet, then the antlions can have almost the same variations, that is by 2017 they will almost face extinction. So there is the death rate or mortality rate with respect to climate change is depicted here, which is part of demography study, which affects the health or the fitness of a species in a region. So this is case study 3, deals with mapping populations at risk, improving spatial demographic data for infectious disease modeling and metric derivation. So this is a study that is done in Tanzania in 2007 in tracking Plasmodium falciparum, which causes malaria in a region. So here they compared estimates of kids under age 5 at risk of P. falciparum. And they overlaid this study on a population distribution map, and this was the distribution map obtained. Figure A shows the rate of P. falciparum parasite in the region. So these dark and red portions shows the highest rate of the parasite present, and in figure B it represents the percentage of residents under 5 years of age by ward. So these brown regions represents the more number of kids under age 5, and see these are the areas where the highest rate of the parasite is present, and in this region how the transmission takes place, that is between these kids, how the transmission takes place is represented by figure C. So that is about the third case study, and fourth and final case study represents the distribution of COVID-19 epidemic and correlation with population emigration from Wuhan, China. So in this study there was reported cases of COVID-19 and how the population migration from Wuhan city and Hubei province, where the first case of COVID was reported, where reported COVID-19 confirmed death cases in Hubei province accounted for about 59.91% and 95.77% of total cases in China. And the hotspot provinces include Sichuan and Yunnan, which are adjacent to Hubei. Then the emigration of people from Wuhan, the correlation was up to 0.943. So the population that emigrated from Wuhan was the main infection source in other cities and provinces. So the high correlation coefficient in the emigration population had helped in concluding that from Wuhan people have migrated and resulted in spreading the disease from the source, that is the Hubei province, to other areas in China. Some cities with a low number of cases showed a rapid increase in caseload. Owing to the upcoming Spring Festival return wave, understanding the risk trends in different regions is crucial to ensure preparedness at both individual and organization levels and to prevent new outbreaks. So, how many people are traveling between areas from Wuhan, knowing in advance their route can help the officials in preparing remedies and prevent further spread of the disease. So, the demographic study of immigration from Wuhan can help in mitigating the disease. And finally, references. So this is the presentation of GIS in demography and health. Hope it helps. And finally, thank you.